So, hello everyone. My name is Sandra Engstrom. Is it okay? Okay. And I am a lecturer in social work at the University of Stirling. And I had the pleasure of meeting Yoon and Terry at the UK Association of Disaster Research conference in Edinburgh in December. And I'm absolutely thrilled to be here and have been learning lots all about Korea over the past few days. And I'm trying not to feel too guilty about my carbon footprint in order to get here to do that. So this is a project that a colleague of mine, Tony Robertson, he's a health geographer, also at Stirling. We co-direct the Extremes in Science and Society research program at the university. And the funding, original funding was from the National Centre for Resilience, which is based out of the University of Glasgow. So this project was pre-COVID, but we're still working lots on it and getting a lot of traction from it. And we're just about to hopefully start a bid to keep it going. So this is a Scottish-based study, just to make that clear at the beginning. So I'm not going to go too into all the different critiques and definitions of either community or resilience, because I know that we'll get lots of that with our other presenters. So this project, the main aim was to identify models of good community resilient practice locally in Scotland and internationally, so that they can inform practices, policy, and research within Scotland, and as well as with international partners such as this. So it's amazing that this is still happening. So we're very happy about that. This presentation is based on the second bit of methodology. Our first, I forgot to turn on the mic in the room, apologies. So our first bit of methodology involved two different workshops that brought together over 80 different attendees from across policy, practice, and academia. And these were held at the University of Stirling. And workshop one, we had a whole day thinking about what is community, what is resilience, what is community resilience. And then we also had discussions about what are possible extreme events, specifically in Scotland at this point, that could be present, and what do we mean by extreme events. Topics that came up were obviously weather or climatic events. We had also talked about disease outbreaks. This was pre-COVID, so that was interesting that we were talking about that already. We also talked about social uprising or events leading to a serious economic downturn, things like landslips, terror attacks, the Clutha helicopter crash, and even the closure of big employees. So Scotland has a big history of mining, of industry, of oil, and a lot of those big industries have shut down over the past few years, and that's having big impact on the communities that these industries have been present in for quite a long time. So we included that in our definition of an extreme event that a community might come in contact with. And then our second workshop looked at improving links between communities and policy. We had some policy workers from Ready Scotland, which is part of the community resilience team of the Scottish government, present. And we looked at what is important when thinking about community resilience, what is missing, what practical steps are needed, what needs to be involved, who needs to be involved, who's not typically involved. And then we had probably what was, I won't say most interesting, but it was certainly interesting. We had a World Cafe session. So different community groups sat at different tables and they talked about how they've come together to support each other in their community, and what has worked well and what hasn't worked well. So we looked at the Eden project, which is a project that looks at building more resilient and better connected communities all over the UK. They use the Big Lunch initiative, where every now and then they bring people together to just share food and share a big long lunch table and get to know each other. We invited the Braemar Care Group, which grew out of a community action plan meeting in 2015, because there was an inability to recruit and retain care staff locally. So Braemar is quite a, not super remote, but it's a pretty remote community in the east of Scotland. So we heard from them. We talked to the Geary Partnership, which is a community-led independent community development organization that uses its members' networks to build stronger, more successful, more sustainable communities. They support people and communities with projects of all sizes. We heard from Sustaining Dunbar, which is a group that collaborates with different individuals in Dunbar, which is on the northeast coast of Scotland, or northeast coast, sorry, not Scotland, kind of the border, almost the border between Scotland and England. They have started things like community fridges, community tool libraries, so just various ways for people to get together and use different community resources. And then we had a group from the Isle of Bute that came together following a significant snowstorm called, the UK likes to name their snowstorms because they don't happen very often. So it was called the Beast from the East. And so they came together after, because this island was basically, the ferries didn't run, they couldn't get resources to and from the mainland, and so they were cut off from during Beast from the East. And so they came together to support the island. So the key findings from the workshop were, so the findings that we've brought together are findings that people thought were really important to bring communities together and to support the building of community resilience. So the first one was social ties and connections. So basically the formation of social capital, if that's a familiar term for a lot of people, based on interests, cultures, locality, different uses of spaces, and there was recognition that that needed to be informal and formal. The experience of shared memory was also particularly important, and there's a lot of evident knowledge about shared identities and place attachment. So how people identify with the physical space where they live and the people that there are around them. Leadership, engagement, and shared responsibility. So thinking about leadership in all of its various definitions, and knowing that leaders can look very differently in different communities, but recognizing that it should be promoted at different levels, and we need to recognize how a community defines leadership, how a group defines leadership, and thinking about the power balances and the structures that groups and communities are often found in as well in terms of local government. Collective thinking and mindset, openness to adapt, openness to cultural change, so a willingness to be a bit more flexible about how to move on and how to, we heard this phrase a lot during COVID, the new normal. What is the new normal? There has to be a bit of a flexibility in terms of what that looks like. Recognizing the importance of inclusivity, equity, diversity, integration of all the different ranges and diversity of people within a community, and the subgroups and all the different levels and all the overlapping identities that people bring, and the importance of that. Communication, social support and coordination. So a lot of people in this space know about the importance of communication, and training and exercising, and exercises, well, maybe you want to do exercises, that's up to you, and identifying local needs. So just being really clear on some training that might work in Dunbar might not necessarily work on in Braemar. So recognizing the importance of having local training and exercises, and identifying local needs. So after the workshops, we identified people from the workshops that we want to talk more to and learn more about their experience and just their insight and communities. So we spoke to, who did we speak to? What was our number? We had 11 people that we spoke to and had further interviews with. And they were a combination of people from the community, in the community groups, and academics, and people that worked in policy, either at the national level or the local government level. And from those interviews, we found additional importance on the role of organizations, formal and informal development, community resilience triggers, and we were particularly interested in this concept of building a movement. So is it possible to build a community resilience movement? So in terms of the role of organizations, we know that we need informal and formal organizations, and we need them to work together. This doesn't always happen the way that we want it to, but there's a recognition that we need both the formal and informal to work together to support as much as we can. In terms of the formal and informal development for effective community resilience, both sides also recognize the significance of the other. Like the quote says, you can't just expect people to become magically resilient because you tell them to, and you can't tell them to magically become a community because you tell them to. There has to be a recognition that it's nuanced, it's more complicated than we probably want it to be, but we do need those informal networks and structures as well as the formal, and they need to somehow be able to identify the other. And then, it may seem pretty obvious, and everyone said that, community resilience is typically triggered following an extreme event. But what also happens is that sometimes that's not necessarily an extreme event for that particular community. Sometimes it's seeing what happens to another community and realizing, oh, if that happened to us, we don't have anything in place to move forward or look after each other, so we should probably do that ourselves as well. And there's one particular, let me see if I can bring it up, quote that I really liked, and it's the shift in thinking from an individual psychology to a community and collective psychology. So recognizing that that's almost when that shift in community resilience happens, is that you think, oh, I'm a part of this group, I'm a part of this place, we need to support each other. So it's that shift in thinking. That quote is in the paper that we will publish afterwards. And then in terms of building community resilience, it's been suggested by one of our respondents that it's effectively an anti-austerity movement, which I think we could probably all agree on, as it would call for adequate resources, financial, people, all the different types of resources, and the emergence of community-led activity and local democracy, where people feel as if they have an element of ownership and control. And this is not a common headspace to have at the moment, due to all sorts of global and world events. There's quite a bit of feeling like we don't have a lot of control over situations that we find ourselves in. But it became very clear that the very definition of a movement is just as nuanced and vague as some definitions of community and community resilience. So we're still working on that one. So the conclusions is that there, and I'm sure we'll be talking about this lots, there's still lots of gaps and obstacles to measuring, understanding, building, defining anything to do with community resilience. The topic of resources, specifically financial, came up regularly and the work is something that was constantly lacking, and that groups and like policy members and local authorities and members of the communities that we were talking to all agreed was lacking. The centrality and role of relationships and trust was met with varying degrees from stakeholders and organizations and community members. That's, for me, as someone who works in social work, and that's my background, relationships are, you know, the core of everything that we think about. And I think a lot of this does rely on having the time and mutual understanding that we need to build positive working relationships at all the levels, and that just takes time that a lot of people don't necessarily have at the moment. There's, and we'll talk, I'm sure everyone else will talk about this as well, there's likely to be continued debate about how we measure community resilience. Do we measure it? How do we measure it? Should we measure it? All these questions that will plague us for the end of our lives, I think. And let me think, obviously research is still needed. That's part of why I agreed to come. Well, there's lots of reasons why I agreed to come to this, but this is one, you know, absolutely keen to keep researching on this area. I'm specifically interested in what, you know, resilience or community resilience in extreme events looks like for different populations. So young people, people with disabilities, refugees, older people, people with mental health diagnosis, all of these different identities are going to have different needs. And yeah, so keen to keep sharing good practice and keep debating everything that we're going to be debating and talking about over the next 2 days. And that is me.